Arkansas is in the middle of a real public health success story, and at a moment that will decide whether it holds. Between 2023 and 2024, overdose deaths in Arkansas dropped by about 24%, the lowest annual level since 2019. And federal data suggests the decline continued through 2025. That's the result of real work. Naloxone, peer recovery networks, state coordination through the Arkansas Opioid Recovery Partnership, expanded treatment, and a lot of community organizing. The numbers are good. They're also fragile. And recovery housing is the part of the response with the most work left to do. Here's a point that's easy to miss. Fewer overdose deaths doesn't mean fewer people have a substance use disorder. It means more people are surviving, which means the number of Arkansans moving through treatment and into recovery is, if anything, larger than before. And every one of them needs somewhere safe to live while they rebuild. For 20 years, the conversation about the opioid crisis has centered on three things: prevention, treatment, and harm reduction. Those are the right priorities. But the full continuum of care has a fourth piece that's often treated as an afterthought: where someone lives in the weeks and months after treatment ends. 2 decades of research is consistent here. People who leave treatment for structured recovery housing do substantially better than those who return to unstable environments. Abstinence up, employment up, arrests down, psychiatric symptoms down. The gap between leaving a 30-day program into a certified recovery residence versus into an unstable situation is one of the largest intervention effects in the entire addiction field. It's the difference between treatment that holds and treatment that doesn't. But there's a quality problem. Arkansas has a growing network of recovery residences. What it doesn't yet have is a consistent way to tell a well-run home from a poorly run one. For years, the field has operated with minimal oversight. Some operators run excellent homes. Others run homes that are, in plain terms, unsafe for residents and disruptive to neighborhoods. And that variability isn't just a consumer issue, it's a public health issue. When a hospital or a drug court refers someone to a home that turns out to be chaotic or exploitative, the downstream costs are relapse, rehospitalization, reincarceration, and in the worst cases, overdose death. Quality standards aren't bureaucratic overhead. They're the difference between recovery housing that extends Arkansas's progress and recovery housing that erodes it. That's why the Arkansas Alliance of Recovery Residences was founded in 2024, to close that gap. As the state affiliate of the National Alliance, AARR certifies homes against NARR Standard 3.0 across 4 domains: administrative operations, physical environment, recovery support, and good neighbor practices. Certification is voluntary, but it's quickly becoming the gate for referrals and funding. State and federal dollars increasingly flow to certified homes. Hospitals, treatment programs, and courts increasingly require it. So what would actually help? A few things. Align state-funded referrals, drug courts, behavioral health, reentry with certified homes. Sustain funding for the certification infrastructure itself: site visits, technical assistance, training. Support operator capacity building, since many operators are in recovery themselves and running homes without the administrative backbone a compliant operation needs. Close the rural gap. Recovery housing is concentrated in a few population centers, and residents in rural counties often have no certified home within reach. And give municipalities clear guidance on zoning, so fair housing protections don't have to be fought out house by house. Here are the stakes. The easy mistake when overdose numbers improve is to declare victory. The decline reflects investment and hard work, but it slows the crisis. It doesn't stop it. The infrastructure that produced the decline has to keep growing, or the decline stops. Recovery housing is the piece that's been underbuilt, and bringing it up to scale isn't expensive relative to what the state already spends on behavioral health. The decisions made in the next 18 to 24 months will shape whether Arkansas extends its progress or loses ground. The full article is linked below, and you can see the infrastructure we're building in the AARR certified directory. If you or someone you love is struggling with addiction, help is available right now. The free, confidential national helpline is 1-800-662-4357. That's open 24 hours a day, every day.